Hello guys, Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. I am Jawahar. Welcome back to Magic Bill session MCQ series, and we are discussing very important topics so far asked in the competitive exams, and also we are discussing the vital points related to that particular MCQs. Okay, so let's begin the session. And before beginning the session, so many students are recommended a particular topic. Please discuss about this topic. So that's why I have selected this topic, that is APGAR scoring. The topic what we are going to discuss today in a detailed way, we are going to discuss about APGAR scoring. So watch the video till the end. Definitely it will be so much useful for you for the upcoming examination. Okay, and also thank you very much for your positive feedbacks. Your feedbacks, making us to post more and more videos, guys. Okay, so if you like the video, please like it, share it, and subscribe the channel. Fine. So let's begin the session with a motivational thought. So just one small positive thought in your morning can change your whole day. One positive thought in the morning will change the whole day. So that is the point. Okay. See, always keep yourself positive. Don't allow the toxic people to surround you. Keep your environment positive. So it will make you to lead the successful life, not only successful life, a peaceful life. Okay, guys. So with this thought, let's move on to the session. And as I mentioned already, APGAR score is the topic what we are going to discuss in a detailed way, all the previously asked MCQs and also the vital points. Okay, so fine. And most of the students asked about the common recruitment exam crash courses. As you all know, February last week, common recruitment exam is going to be there. So for facing the exam, many students asked about the crash course. Already the crash course is running in Metier. So if you want to join, it is 35 days short-term review course. So evening from 3:30 the session starts. So you can contact this number, that is 9600-543-3642 and also 8939890642, so that easily you can join our classes. Okay, fine. So let's begin with a simple to complex way. Okay, so what is APGAR score? One point you're supposed to remember if you think about what is APGAR score. Okay, what is APGAR score? The word what is coming means immediately you have to say numerical method of evaluating the newborn condition. What method? Numerical method of evaluating the newborn condition. That is called as what? APGAR scoring. Okay, so numerical in the sense we are using the numbers from 0 to 10. We are using the numbers and we are evaluating the newborn. Okay, so that is called as what? APGAR scoring. This is the first important point. Suppose in the exam, the numerical word is not in the option, then what should I do, sir? If the numerical word is not there, you have to search for objective method of evaluating the newborn. What is that? Objective method of evaluating. Both the answers are correct. Numerical method of evaluating or objective method of evaluating the newborn condition. Okay, so this is called as what? APGAR scoring. Fine, let's go in detail. So who introduced the APGAR scoring? This is the second important point. Many times this question asked in the exams. The name of the person who introduced APGAR score. This question many times asked in the exams. Okay, so Dr. Virginia APGAR. Dr. Virginia APGAR is the person who introduced this APGAR scoring. So when it was introduced in 1952. Okay, who? Dr. Virginia APGAR. When? That is 1952. And who is this person? Dr. Virginia APGAR is a anesthetic. That is obstetrical anesthetist. Okay, so these 3 points, please remember. Dr. Virginia APGAR is the person who introduced this APGAR scoring. When it was introduced in 1952. And who is this person? Is a obstetrical anesthetist. This question is also asked in the exams. Who and who is he? Okay, fine. The next vital point is APGAR scoring is a 10-point system, guys. Okay, so the minimum scoring is going to be from 0 and maximum scoring is going to be 10. 0 to 10 is going to be the scoring. That's why it is called as what? Newborn method of evaluating the newborn. Okay, so it is a 10-point system. APGAR scoring is a 10-point system. In the exam, you can get this type of options. APGAR scoring is a 5-point system, 10-point system, 3-point system. So you have to select what? 10-point system. Okay, the next one, in APGAR scoring, what are all the signs will be present, or what are all the signs we supposed to observe? So if this option is there, you have to think about 5 things. This is very important. Okay, so what are the 5 components we supposed to think? Appearance, pulse, grimace, activity, and respiration. These are all the 5 components what you are going to observe as a sign in APGAR scoring. Okay, so appearance. See, actually, appearance means you are not going to stimulate the patient. You are just going to see the baby, newborn baby. Okay, you're not going to stimulate by, inserting the catheter in the nose or flipping the sole of the foot. You're not going to touch the baby. Just you're going to observe the appearance of the baby. Okay, whether the baby is pink or whether only the peripheries are pink or whole bodies are blue. So what changes is there in the baby skin color? Okay, so appearance, we are going to see only the baby skin color, the first point. Second one, pulse, you are going to check the heart rate. Third one, grimace. Grimace means reflex, baby, whether the baby is having a good reflex or not. Activity, whether the muscle tone of the baby is good or not. Respiration, the breathing effort or breathing pattern. Okay, so these 5 things we are going to check. Appearance, that is color, pulse, heart rate, grimace, reflex, activity, muscle tone, and respiration means respiratory pattern. So these 5 things we are going to evaluate. These 5 components we are going to evaluate in the Apgar scoring. Clear? Yes. So on the basis of this only, the content is going to be. Okay, fine. Let's move little more deeper. See, if you understand this slide clearly, it will be very, very easy for you to solve any question asked from the Apgar score. Please make a note of it. See, this content is the mixture of all the MCQs. Okay, if you Google it or if you see in the book, appearance, either they will be given as appearance or they will be given as color. Okay, either they will give blue or full cyanosis. But what I made is I have mixed each and every words which is essential for your exams, and I made this content. Okay, so just take a screenshot, otherwise take a register and write it out. Okay, fine. So as I mentioned already, just thoroughly understand this concept so that it will be easy for you to face the exam. So let's see one by one. The first component what we are going to discuss is appearance, color. So here we are not going to stimulate the baby, just we are going to observe, going to see the baby condition. Okay, suppose let's start from 2 to 0. As you know that the maximum score is 10. If you add 1, 2, 3, 4, 5, all these 5 components, the maximum score we are going to get is 10. And the last score what we can get is 0. Okay, and the means minimum score, the average score what we are going to get is 1, 2, 3, 4, 5. Okay, so 10, 5 and 0. Fine. Okay, let's see one by one in detail. The first one what we are going to discuss is appearance, that is color we are going to check. Okay, in the exam, either they will be asking appearance or they can ask color or they can ask code with image. Whatever they are asking, you should think that it is nothing but appearance. Okay, fine. So if the appearance is pink, if the baby color is totally pink, that is normal. That is normal. If the baby color is, body is pink, but the extremities, let me show the image. Yes, see, the body is pink. The body is pink, but the extremities are blue. The extremities are blue. That time it is called as what? Acrocyanosis. What is that? Acrocyanosis. Body is pink, but the extremities are blue. Cyanosis is present. Okay, so it is called as what? Acrocyanosis. In exam, either you have to search for what? Acrocyanosis, or you can search for partial cyanosis. Both are correct. Okay, fine. So if this acrocyanosis is present, the scoring is 1. And full body, the cyanosis is present. All over the body, the blue color discoloration is present, means that is 0. Okay, so in the color or in the code of image, what are the things we are going to see? The 2, that is pink color means normal, acrocyanosis means 1, and full cyanosis, that is fully blue in color, means 0. So these 3 things we are going to see in the appearance. Okay, the next one is pulse rate, heart rate, very simple one. See, if you know the normal heart rate, then it is very, very simple. The normal heart rate of the newborn is 120 to 160 beats per minute. It is a repeatedly asked question. What is that? 120 to 160 beats per minute. Okay, and if in what time we have to give score 2, more than 100 beats per minute is there, means the scoring is going to be 2. If less than 100 beats per minute, the scoring is 1. And if there is no heart rate, then the scoring is going to be 0. Fine. Let's move on to the next one. Grimace. Grimace is nothing but reflex, guys. What is reflex? It is an involuntary response from our body. Okay, you know about, sneezing reflex, coughing reflex, Achilles reflex, patella reflex. All these things are what? Involuntary response from our body, that is called as what? Reflex. So here also we are going to check the reflex of the baby. In exam, you can get, either you can, they can be asked like a grimace, the word in the option I'm saying, okay? So in the option, you can have to search for grimace or facial expression or involuntary reflex or involuntary response. So whatever it is, they are asking about what? Grimace only. Okay, fine. So how to check the grimace? So just jump over here in this area. See, for checking the reflex or grimace, we can use 3 techniques. Okay, these things are very, very important, guys, because we are going to work in the practical aspect. So all these knowledge should be there for you. Okay, so 3 things we have to check. What are the 3 things? We are going to check the reflex. For example, if you want to check the sneezing reflex, take a catheter, oropharyngeal catheter, and just insert in the nose. Sorry, nasopharyngeal catheter and insert in the nose. Okay, immediately the baby will sneeze or cough. Otherwise, take a oropharyngeal catheter and insert in the mouth. Again, the baby will sneeze or cough. Okay, so these 2 techniques we can use. Otherwise, in the sole of the foot, just flick like this. Okay, so this is also a technique in order to make the baby or check the baby's reflex or response. Okay, fine. So all these 3 techniques we can use. Suppose if the baby, after stimulating the baby is crying vigorously or lusty cry. Lusty cry is also the normal finding. Vigorous cry is also called as what? Lusty cry, guys. Vigorous cry is also called as what? Lusty cries. Okay, on stimulation, there is a vigorous cry or a lusty cry. Otherwise, cough immediately on stimulation, sneezing immediately on stimulation. All these findings are present means you can give score what? 2. Okay, but after giving a stimulation, there is no response. So you are increasing the intensity of the stimulation. That is called as what? Aggressive stimulation you are doing. Okay, you are doing what? Aggressive stimulation and inducing the cry. In this situation also, mild cry is present. Mild response is present. So that time we can give the scoring 1. And the last one, no response after giving the stimuli also. Aggressive stimuli also. Then no response, we can give the scoring 0. The next one, activity. Here we are going to check the tone of the muscles. Okay, whether the baby is flaccid or active. We are going to check the tone of the muscles. Okay, so how to check? So here, just we are going to observe. Just we are going to observe the baby. Okay, so while observing, if the baby is having good flexion, see, after the delivery of the baby, in the mother's womb, first let's understand this concept. In the mother's womb, the temperature what the baby has is 37 degrees centigrade. How many degrees centigrade? 37 degrees centigrade will be there in the mother's womb. But once the baby came out of the mother, for example, you are doing LSCS surgery, lower segment cesarean section. So the baby will be delivered in the operation theater. Okay, what is the temperature of the operation theater, guys? Very important question. 20 to 25 degrees centigrade. So especially for LSCS, this kind of operation surgery is going on means average temperature what they will keep is 23 degrees centigrade approximately. If they are asking in ratio 20 to 24 and average is 23 degrees centigrade is the OT room temperature. Okay, so far the baby is in 37 degrees centigrade in mother's womb. Suddenly after the delivery, the temperature of the environment is decreased from 37 to 23. Okay, so that time what will happen? The baby will go for what? Hypothermia. What will happen? Hypothermia. That's why the baby is getting what? Acrocyanosis. What will happen in case of hypothermia? Blood vessel contraction will take place. Yes, from the aorta till the very blood vessels, everything is going to get contract. Okay, say aorta is a big blood vessel, so the contraction of the aorta doesn't matter anything, but a small blood vessels which is present in the peripheries, it is going to contract a lot. So that time what will happen? Cyanosis will take place. That's why acrocyanosis. It is a normal mechanism for maintaining the body temperature. Fine. Okay. So the same way, not only the blood vessels are contracting, the baby is also doing what? Flexion. Okay, let me show the image. I think the image, yes. Like this, the flexion will be there. A good flexion will be there from the baby. Okay, so if the good flexion is present in order to maintain the hypothermia. A complete flexion is present. A good flexion is present to prevent the hypothermia means we can give the score 2. A partial or minimal flexion is present. The baby is not having adequate, muscle tone. A minimal flexion is present means we can give the scoring 1. And the baby is totally flaccid. If you are lifting the baby is like this. There is no flexion. Okay. So that time we can give what? Flaccid, floppy, limp. These words you have to search in the option. For example, in the exam, they are asking the question. In the newborn assessment, in the first minute, you are giving score 0 on basis of what finding? So this is the question. And you have to search for the options like, either flaccid, limbs in extension, or floppy, or limp. All these words are correct words for giving the score 0. Okay. Floppy, flaccid, limp, and limbs are in total extension. If these words are present, you can give the score 0. Okay, and the last one is respiratory effort or respiratory pattern. Very important point I'm going to tell now. Here we are going to check only the respiratory effort of the newborn or respiratory pattern of the newborn. We are not going to check the respiratory rate. Please underline this key point. Very, very, very important. We are not going to check the respiratory rate. We are going to check only the respiratory effort or respiratory pattern. Okay, if the respiratory pattern is good, how to check? Once after the delivery of the baby, till the delivery of the baby is getting oxygen from the mother. So no problem at all. Once after the delivery of the baby, immediately after the first breath, the lungs are getting opening. The alveoli starts to work. The heart is going to exchange the deoxygenated blood to the lungs for purification. Right. So all these mechanisms, suddenly it is going to happen. Immediately what will happen? The baby starts to cry. If these things are happen, what will happen? The baby starts to cry. Otherwise, we can say like this also, that once the baby starts to cry after the delivery from the mother, once the baby starts to cry, immediately the lungs is going to expand, alveoli is going to expand, oxygen is going to be get from the environment. Okay. So after the delivery of the baby, strong cry is present or regular cry is present, we can give the score 2. If weak cry, otherwise labored means what? Weak cry is also called as what? Labored breathing. These words you have to keep in mind, guys. Either in the exam, they will be asking labored breathing or weak cry, gasping, irregular breathing, slow breathing. So whatever the breathing they are mentioning, we have to give the score what? 1. In scenario question, mostly they will be asking what? Scorings. We will be discussing that. Okay. And there is no cry at all. Then we have to give what? Absent. 0 score. Okay. So this is the thing. So again, I'm telling, we are going to check only the respiratory pattern or respiratory effect. We are not going to check the respiratory rate. Not going to check what? Respiratory rate. So all these vital points are very, very important for the exam, guys. For understanding the Apgar score in detail, you're supposed to know this. Okay, fine. So let's move on to the next important things. Already we discussed about this slide, that is apgar-cyanosis. So other vital points related to Apgar scoring. Let's see. Scoring system in Apgar. All the points are MCQ points. All the highlighted points are MCQ points. See, the total scoring is 10. Minimum scoring, if they are asking in the exam, means 0. And maximum scoring is 10. Okay. So total scoring is 10. If the score is 0 to 3. What is that? If the score is 0 to 3, then it is severe depression. The newborn is in severe depression. We have to start the resuscitation. Underline the key point. We have to start the resuscitation, newborn resuscitation. Understand? And the next one, if the score is 4 to 6, that is mild depression, administration of oxygen, warming the baby, that is more than enough. Okay. If the baby score is 7 to 10, that time mild, there is no mild depression. It is only means there is no depression at all. Just a normal care is enough for the baby. So once again, I will repeat, 0 to 3, resuscitation is required because of severe depression. 4 to 6, very mild depression. Okay, so here oxygen administration providing warmth, and 7 to 10 is normal. Normal care is enough. Okay, so all these 3 points is very, very important. The next one, as you all know, 2 times. The mandatory checking of Apgar score is 2 times. Mandatory. Mandatory means what? Definitely we have to check for 2 times. In the first minute and in the 5th minute, we have to check the Apgar scoring. Everyone knows about this. But why? Why we need to check in the 1st minute as well as in the 5th minute? One time checking is not enough. See, in the first minute, why we are checking? First, let's discuss that. The baby is in mother's womb in 37 degrees centigrade, right? After the delivery of the baby, suddenly she is coming and meeting the environment. The environment is averagely 23-24 degrees centigrade. There is a huge difference in the mother's womb 37, outside 24 degrees centigrade. Right? So the baby has to adjust to the environment. There are so many changes has to undergone in the newborn's body. Okay, so that's why within 1 minute, that is in first minute, we have to check the Apgar score of the baby, whether the baby is adjusting to the environment or not. For assessing that, we are doing the Apgar score checking in the first minute. Suppose if the scoring is 0 to 3, immediately we have to start the resuscitation. Resuscitation, very important. Okay, so first minute we are checking whether the baby is adapting to the environment or not. Why we need to check again in the 5th minute? See, mainly why we are checking means if the baby score is 0 to 3 or 4 to 6 in the first minute, so definitely it is mandatory to check in the 5th minute also, because for some baby it will take some time. Even for, if you start the resuscitation, if because the scoring is 0 to 3, you already start the resuscitation. After giving resuscitation for 5 minutes, again check the baby. Some changes will be there in the Apgar. Some improvement might be there. If the improvement is there, then it is well and good. If the improvement is not there, okay, so that time neonatal mortality will take place. Okay, neonatal mortality will take place. Okay, so just to check whether the baby is adjusting to the environment, or after giving the resuscitation, whether the prognosis is good or bad, to assessing that, we are checking the Apgar in the first as well as in the 5th minute. Okay, guys, so these two important points over. The next important point is Apgar score. Suppose if it is less than 7. What is that? If it is less than 7 means it will come in these two category. Okay, so now what we supposed to do? See, it shows that the newborn in either severe depression or in the mild depression, we have to start the resuscitation. Okay, and every 5 minutes we have to check the Apgar score until 20 minutes. Very important point, guys. Every 5 minutes we have to check until 20 minutes. We have to check continuously for every 5 minutes. Okay, the last one, after checking for 20 minutes also, persistent decrease in the Apgar score. Persistently the Apgar score is decreasing. Then there is a high chance for neonatal mortality. Okay, so all these highlighted points is very, very important for your exams. Okay, fine. So now let's enter inside the question answer discussion, guys. Okay, so far we have covered the introduction, that is the base of Apgar score. Okay, if you know that, then you can easily solve all the question which is related to Apgar scoring. Let's see one by one. What is the primary critical observation in Apgar score? You know that in Apgar score, appearance, pulse, grimace, activity, and respiration. These are all the 5 components which is present in the Apgar score. Among these 5, which is very, very critical observation, among these 5 components, which one has to be observed very critically? So this is the key point. Okay, so here the 4 components they have given here, and the right answer is heart rate. So here the critical observation we supposed to do on the heart rate, because based upon the heart rate only, the grimace, that is the muscle tone, the appearance means the color of the baby, everything is determined by the heart rate. Obviously, we are not going to check the respiratory rate, so we can exclude that. We are going to check only the respiratory pattern or respiratory effect. We are not going to check the respiratory rate, so we can exclude this. Other things like, grimace, that is activity, appearance, whether the baby is having acrocyanosis or normal, everything is based upon what? Heart rate only. So heart rate is the critical observation in the Apgar scoring. Clear, guys? So that is what I have mentioned here. Okay, so heart rate is the critical and primary observation in Apgar scoring, because it determines the physiological status of the newborn. Okay, the next question is, which of the following is not the component of the Apgar score? Not. Negative question. Okay, so let's see what all the options they have given here. Color of the baby, muscle tone, heart rate, respiratory rate. Hope you know the answer here. So which is not the component? Definitely we are going to check the color of the baby in the appearance. By checking the appearance, is nothing but color of the baby. Muscle tone, grimace. Okay, so in grimace we are going to check the reflex. In muscle tone we are going to check the activity. Okay, so definitely muscle tone also we are going to check. Heart rate, obviously we are going to check the heart rate or pulse rate. And what about the option D? We are not going to check the respiratory rate. In the previous question also I said the same thing. Because why I'm repeating the same thing again and again? Most of the students are making mistakes here. Okay, we are not going to check the respiratory rate. We are going to check only the respiratory pattern. Clear, guys? So all the vital points I have added here. You can see here. We are going to check the color of the baby, that is appearance, muscle tone, that is activity, heart rate, that is pulse rate, and respiratory pattern or respiratory effect we are going to check. We are not going to check the respiratory rate. So here, which is the right answer? Option D, that is respiratory rate is the right answer. Okay, the next one. The initial nursing action after the birth of a preterm baby with the Apgar score of 8. With the Apgar score of 8 should be. Okay, see, here always you have to find out the key points from the question. Here the key point is baby is preterm and Apgar score is 8. So what is the nursing action? These 3 key points you're supposed to remember. Okay, so let's see the options. Apgar score is 8, guys. Okay, so you know that. Just check here. 0 to 3 means severe risk, 4 to 7 means moderate risk, 8 to 10 means mild risk, or it's normal, right? Almost normal only, 8 to 10. So in this condition here they have given the score 8. So now what we supposed to do as a nurse? 4 options they have given here. Among these, the right answer is going to be option D. Because the scoring is normal, we can go with just dry the baby, place in the warm environment. No need to clamp and dry the umbilical cord here. Okay, assist the physician with resuscitation. No need to do the resuscitation because the baby scoring is normal, 8 to 10. If the scoring is 0 to 3, that time we have to think about resuscitation, right? The next one, apply the footprint, apply identity card, we can identification band. We can delay this procedure. Right, no need to do it. It's not an emergency one. Applying the identification band is immediately is not an emergency. Obviously we're supposed to do that. It is not emergency. But 8, if the score is 8, then the baby is normal. Just dry the baby and keep in the warm environment. So which is the right answer here? Option D is the right answer. Okay, so the next one is scenario based question. A newborn baby of 1 minute after the vaginal delivery. 1 minute is finished after the vaginal delivery. Pink with blue hands. Okay, actually they are asking the scoring here. Okay, blue hands means acrocyanosis. Body is pink and hands are blue. Acrocyanosis is present. For acrocyanosis, what score we will give? 1. Okay, fine. So keep 1. Having the heart rate of 140 beats per minute. This is the second key point. 120 to 140 beats per minute is the normal heart rate. So how much scoring we can give? 2. Okay, so total 3. Okay, the next one, prompt response to stimulation with crying. So with stimulation, immediately crying. So score is 2. Maintain minimal flexion with sluggish movement. Minimal flexion is maintained with sluggish movement. Okay, so minimal flexion with sluggish movement is 1. Okay, and nurse should know that this newborn Apgar score is. Okay, let's see one by one the option 6, 7, 8, 9. Okay, so once again we can repeat. Pink with blue hand 1, lusty cry 2, having heart rate of 140 beats per minute 2, prompt response to stimulation again 2, maintains minimal flexion with sluggish movement 1. Okay, so totally how much it is? 8. Okay, see, for your better clarification, so here the answer is going to be 8. Let me tell you with the better clarification. Okay, pink with blue hand is the first point what they have mentioned. So the scoring is going to be 1. The lusty cry means a vigorous good cry. That is called as lusty cry. So 2 is the scoring. Heart rate 140 is the normal one. So we can give 2 scoring. Prompt response to stimulation with crying. If you are giving stimulation, immediately crying is present. So scoring is 2. Maintain minimal flexion. So scoring is 1. So let's add 1, 2, 3, 4, 5, 6, 7, 8. So which is the right answer here? Option 8 is the right answer. This is how you will get the questions in the exams. Scenario based questions are definitely you can expect in the NORCET exams. Okay, fine. The next question. Which of the following is considered score 1 according to Apgar score? They are asking about what score 1. Okay, so let's see how they are relating with the options. Score 1, well flexed baby, heart rate 140, acrocyanosis, cry loud. Among these, which is getting score 1? See, well flexed baby means what is the score? 2 is the score. Heart rate 140 beats per minute, again 2 is the score. Acrocyanosis, obviously for acrocyanosis, which is the score? 1 is the score. And cry loud, cry when stimulation, 2 is the score. So, which is the right answer here? According to the question, score 1 according to Apgar score is acrocyanosis. Acrocyanosis. So, here the right answer is what? Option C, that is acrocyanosis. Okay, so this is how they will ask the question, guys. Okay, even though it is a direct question, but still, if you know the scoring, then it is easy to answer. If you don't know, that time you will get the problems. Okay, let's see the next question. Apgar score is done to assess the baby for which of the following? Direct question. Apgar score is done to assess the baby for which of the following? So, which of the following question? So, 4 options they have given here. Among these, why we are assessing the baby for Apgar score? For assessing the birth defect, assessing the respiratory rate, assessing the blood volume, assessing the adaptation to environment. What do you think? Which is going to be the right answer? Why we are doing the assessment for the newborn by using the Apgar score? Obviously, not going to check the birth defect. We are not going to check the respiratory rate. We are not going to check the blood volume, obviously. And then, which is the right answer? We are going to check the adaptation to environment. That's why we are assessing the baby in the first minute as well as in the 5th minute. Okay, how the baby is adjusting to the environment, how the heart, lungs, brain is adjusting to the environment. That we are going to see in the 1st and 5th minute. So here the right answer is going to be what? Option D. The next question. The baby born at 38 weeks of gestation. Just after the birth, healthcare provider check the Apgar score that is below 3. This is the key point, below 3. So what is the immediate action? If the Apgar score is below 3, you know that very well already. I explained resuscitation, newborn resuscitation we supposed to start. Okay, so here, which is the right answer? Document the finding is wrong. Wait and reassess is also wrong. Gently rub and provide stimulation and oxygen. It is also wrong. This one we can give for mild condition, that is 4 to 7. Okay, and document the finding we can give for more than 8 scoring. But here immediate neonatal resuscitation we supposed to do because the score is below 3. Always the score is 0 to 3 means we have to start with neonatal resuscitation. Okay, fine. So the right answer is option D. The next one. That's it. So if you know all these, first we have started with the basics. Okay. Along with the tableau column, all the vital points I have added in the tableau column. If you know that and the introduction part, who introduced this Apgar score and all the vital points I have added in the introduction, right? So with that, if you are started to solve the question, then it will be easy for you guys. Okay, fine. So we have completed Apgar scoring. If you have any doubts anywhere, you can drop your message in the comment section. And you know, in New Delhi, those who are from New Delhi, we are running the batch, offline batch from evening 2:30. Sorry, from 2 to continuously 7. We are running a evening batch. Mostly we are focusing on NORCET 8 as well as ESA exams. See, if you attend these kind of classes, you can face any exams like, ESI, JIGMAR, RRB, NORCET exams. Every exam you can means clear very easily. Okay, so what you're supposed to do is, just attend the classes and just check how the classes is. If you want to continue, you can continue the classes. So just opposite to Max Hospital, Saket Max Hospital. So Metier International Academy center is located and the batch is running every day. So if you want to join, just you can see the numbers here. Okay, so just contact these numbers like 977374539 One more number is there, that is 9560437344. Just contact to this number and join as early as possible and clear the exams in the first attempt, guys. Okay, so thank you very much for watching the video. If you have any doubts anywhere, please drop your message in the comment section. Thank you very much and all the best for your upcoming